to prevent a polyp from becoming cancer. These are examples of polyps. So not all polyps are created equal. Some polyps could be small, some polyps could be big, some polyps may have a stalk, we call it pedunculated. Some polyps can progress to cancer, some polyps will not progress to cancer. So there are factors that could actually predict, and this includes the size of the polyp. The bigger the polyp is, the higher is the risk for progression to cancer. The more polyps you have, the higher is your risk because there's 2 or 3 growing in your system. And if you look under the microscope, if you do a pathology, polyps that are of the villous histology are actually have a higher risk to develop into cancer. Okay, so I'm showing a diagram here in which removal of polyps, which we call polypectomy, can actually prevent cancer. So here, this is a polyp. This is during a colonoscopy. So this is the tip of the colonoscope, which is an instrument that we use to insert through the rectum. And this is what we call a snail. So it's like a lasso. You put it around the polyp, and then you snug it tightly, and then you apply cautery, and then you actually cut the polyp. And this polyp is the one we submit to the lab for pathology studies. So, as you could see, if we remove the polyp, then we prevent cancer in a way. Okay? So here is a polyp, and here is cancer. With polypectomy, we could stop cancer. I think that's one of the points that we have for this lecture. So screening is actually defined to be doing tests on patients who do not have symptoms. But I think for our audience, we need to find out what are the symptoms of colon cancer. It could be rectal bleeding, you see blood in your stools. You could have pain. You could have an obstruction, there's blockage in your colon. With continued bleeding, you could develop anemia. You could develop constipation. So if you were having regular bowel movements before, once a day, and now you're starting to have one bowel movement every 3 days, that is a warning sign. And also, weight loss is good, but if it is actually unintentional weight loss, that's a concern. Another thing that we want to emphasize is early cancer may not present without any symptoms. So there's no point of waiting for symptoms to occur before you get screened. Okay, another reason why we screen. Okay? Cancer that is diagnosed at an earlier stage has a better clinical outcome compared to cancer that is diagnosed at stage 4. So if you got diagnosed at stage 1, you just need surgery, and in 5 years, there's a 93% chance that you're still alive at the end of 5 years. Stage 2, it goes down to 78%. Okay? But if you get diagnosed with stage 4, so that means the cancer has spread to distant organs like the liver and other lungs and other organs, the probability of actually being alive in 5 years is only 8%. So even if you get diagnosed with cancer, we want to make sure you get diagnosed at an earlier stage for a better clinical outcome. So this slide kind of summarizes why we need to screen for colon cancer. So number 1, as I mentioned, it's a common cancer. It's number 3 in the Philippines. There is actually a period, remember, that we could actually intervene. If we find a polyp, we'll take it out, and we prevent the person from developing colon cancer. There is an acceptable treatment early on in the stage in which we could result in a better outcome. Remember, if you got diagnosed with stage 1, then your 5-year survival is much higher compared to stage 4. And we actually have tests that are simple and affordable, and we will be discussing this later. Okay, so we already